Good afternoon. Welcome to Health and Human Service Committee, Wednesday, February 19th. It is 1 p.m. I'm Travis Brooks, and I'd like to call this meeting to order. All right, we don't have any changes to the agenda. Is there any public comment?
Nope.
All right, we don't have any public comment. Minutes approval from January 15th. Do we have all right. All in favor? All right, I guess the minutes are approved and moved. Appointments. We have 3 advisory board appointments, ID 13090. Recreation Partnership Board, Randy Brown, term expires December 31st, 2025. Community Mental Health Service Board, Mental Health Subcommittee, Tom Delara. Community member, term expires December 31st, 2028. Human Rights Commission, Nassim Varga, commissioner, term expires December 31st, 2027. Do I have a mover? Do I have a second? We have a second. All those in favor? All right, we have.
Opposed.
Oh, sorry. All those opposed?
Thanks.
Chair's report. So this is my first time chairing the Human Service Committee. I tend to move fast, so please slow me down if you need to. I'm not trying to take Amanda's trophy, but things will be crisp. Things will move along pretty quickly. I don't like to waste anybody's time, so please tell me if I'm moving too fast so I don't miss anything. I know these meetings are important. I know they're important for the community to hear. So at any given time, please just say, slow down. One of the items for report and discussion is the Office of Human Rights, and we have a few different options here. What I would hope to do is for this committee to kind of share some ideas and direction for Corsa and his team, so they can explore and come back to us with different options or different plans for us to choose from. Does that sound good to everybody? Is that good with you, Corsa? Yes. All right, cool. So I open the floor for discussion. Susan.
Last year I had the honor of being the liaison to the Human Rights Commission, and I had worked with Dr. Clark over the years, and previously at the library with him. So the commission did an amazing job in the last couple of years, sort of reorganizing themselves, and they offered programming that I thought was really valuable. They had a special, it was by Zoom, and it was about women's health issues. And then they were preparing some other things. They did quite a number of community things. So I hope that, in looking at the human rights, the office, that the commission members might participate in suggesting ideas. I think Ann Corman is the liaison this year, but they did a lot of valuable work. And I also had worked with the commission in the past for issues that came up in the library. So, but I also see with our new, with Charlene Holmes Department, I wonder if there's something that we could do with some of the work that they're doing and looking at a new way of having a human rights commission. So I'm sort of brainstorming here, chairing. So, I think there are a lot of possible opportunities. I just would like to see the commission recognized for the work that they have been doing.
Thank you. Amanda?
Yeah, thanks for that. I think the commission has grown and changed so much in the past couple of years, and they seem to really be on point. So I hope that will continue. And I would like to hear from them, like what they envision, and I guess I would also like to hear from Corsa, if you have thoughts or if you've had a chance to think about this topic yet, or anything.
Yeah, so over the last couple of weeks, I got the opportunity to meet with the commissioner, Pei. And also, unfortunately, I couldn't attend their meeting, but I believe they have a meeting coming up next month that I will be present. And also been working very close with challenge, trying to situate the office, trying to understand how the makeup was previous number of years and how we move forward with that coordination of the functions and the role. So whatever we propose or we looked at will hugely involve the commission. It appears there's a broader acceptance of the work of the commission, and there's some degree of lack of specificity to the office itself. So we're trying as much as we can to make sure the office responds to the needs of the commission, whilst also responding to the needs of the legislators, and marry all those pieces together properly in terms of how the office becomes effective, especially this time and everything that we have going on. The critical thing that we identified was that the director was also the fair housing officer. So we need to make sure we get that position done quickly, because for our CDBG grants, we have to have a fair housing officer in place at all times. So that requires very effective work right now to make sure we get that in place. So it's broad, but we've already started some work, and we should be getting something to you guys as quickly as possible.
Susan?
So one of the things I think they also did was help guide people, and if there was a need to file a complaint, it's filed in Binghamton, I believe. And so is that something that would be also, I didn't realize about the fair housing, I think that's really important. But is that something that would also be taken into account, as how to, if community members need to know how to file a complaint? And I also want to say Paye has been an amazing chair of the Human Rights Commission. Just shout out to her.
Yeah, so it's basically everything that the committee or the office was doing well. And I think one of the biggest challenges that I have identified is some degree of breakdown in communication and engagement with the various units. And that's why we're trying to put the structures in place to iron those differences out. But yes, there will be the continuity of those work, and also better engagement with the community, and also being more visible and present in terms of addressing community needs.
So I think when we were having conversations about this office in the recent past, there were different concerns that were raised about what the office was created to do and what it's now allowed to do by law. Is it now more of a programming type of office? And then what are the options moving forward? Do you keep the office and understand what the limitations are and build the office around that? Or do you figure out how to keep the work of the office and figure out what that can look like in a different way? There's this fair housing position, and can that be incorporated somewhere else by somebody else? So I think that's, for me, part of what I would like to hear at some point is, here's the options, this is what they would look like, and these would be the outcomes on each one moving forward. Is it possible to create some sort of, and I don't know if it's a working group, a task force, I don't know what the proper word is, that's comprised of commissioners, maybe a legislator or two, folks from the community, maybe even the CJC, and people from your office to kind of figure it out? Because the last thing I want to do is take an office like Office of Human Rights and get rid of it, right? Without the community being involved in that, or change it without the community being involved in that. So is it possible to bring some people together to help kind of come up with the best way to move forward, and then for you all to figure that out, what that exactly looks like afterwards? Is that a possibility?
Yeah, we can explore that. Yes, we can take that direction from you guys and explore it.
Like a task force.
Yeah, like a task force. How does that sound to the committee?
It's a great idea.
Randy?
Yeah, I like that. I like what everybody's been sharing here. And defining really what the role, I think, is really important. I know a couple times when we've had issues, community members felt they weren't being heard. So I'm hoping that somehow this role or this position would be a support for not only the people from the public, but also the departments that need assistance clarifying communication or whatever, so.
Thank you. Yeah, this is good. Kelly?
Yeah, may I just confirm it would be called a working group? And if you guys could come up with a title for that.
Okay. So should we come up with a title? Anybody want to?
The awesome Office of Human Rights Working Group.
I like that. How's that sound, Corsa?
Very professional.
Feel free to edit.
So we're good with the Office of Human Rights Working Group, the awesome office. You want to take awesome out, don't you?
Yeah.
All right, we could lose awesome. We could lose awesome. So Office of Human Rights Working Group. Is there any legislators that would like to be part of that?
I mean, if there's a need, I would follow.
I think it would be great. You've been part of the commission. You've been with the liaison. I think it would be great.
I would participate. I think it's really important,
Okay.
especially now.
Did you say Annie is the liaison now?
Liaison, she should be, that's what I was gonna say, is if
Oh.
you needed, I would ask Ann as the liaison, but if there's a need for another, I mean,
Yeah, I
would be
mean, there
willing.
should be a couple of legislators,
Yeah.
and I'd be happy to do it too.
Yeah,
Okay.
so if needed, I mean, absolutely, I would.
All right, cool.
Can I say one other thing? Just in terms of the commission, like, I assume that they've had a staff person attend in the past. Like, usually our advisory boards have a staff member who either takes the minutes or, you know, whatever, helps with that. So I guess if there isn't a staff person at this time, I don't know, I would just wonder how that's going to work. Because, I don't want them to just be off doing their own thing and not connecting, or maybe the chair could connect with you and come to this committee, or I'm not sure.
They did elect, last year, they elected a president, a vice chair, a chair and vice chair, and a secretary who takes the
Secretary.
minutes.
Okay,
But there was, Dr. Clark attended as the staff person.
yeah.
And I know they had a few meetings once he retired, but I don't know how they're doing that now. Annie would know probably.
So it's kind of like two tracks. There's what's happening now,
Yes.
and then how this works long-term.
Yeah.
So is it, can we invite them, or at least that person, to come to these meetings in the interim till we figure out the long-term plan so that they are connected? Can we do that?
Yeah, I will engage Pay in terms of the next committee meeting, and from now out to March 19th, we'll figure something out.
Okay,
Or at
awesome.
least quarterly or something. I mean, she doesn't have to come to every meeting, but, yeah.
Okay, that sounds good. Thanks for bringing that up, Amanda. That sounds good.
Yeah.
So you'll send out something for us to connect and figure out the group, and
Yes.
I know that in talking to Dan Cornell, doing the probationary resolution for the GIVE grant for officers to be able to carry sidearms, I had suggested that in terms of connecting with the community, to start with Mona and the CJC, it seemed like a good fit. And he had a good experience with Mona, and she had a good experience working with Dan. So maybe that's a good group to start with in terms of bringing the community into this conversation. They're she's a county employee. I think that it falls in the scope of their work, and then there's the community piece. So that might be a simple way to bring community in and being able to utilize the CJC.
Thanks.
And probably WDIC too, because they
Oh, yeah?
they already have community members. I think Annie's on that as well, so maybe she could be the connection.
Oh, yeah, that would be a good idea.
But the people who are on that would, you know, they're already connected, so,
Yeah, I want to make sure we get this one right.
yeah.
The CJC is a great idea.
Cool. I do have one ask for those of you all in the committee. Could you send me goals that you would like to see this group work on this year? And and we could talk about that in March. I can send something out to everybody beforehand, so then we can have a decent discussion in March. But I think it's important for me to hear what y'all want to work on, not just what I think is best. So I want to incorporate that in for everybody.
Great.
That's the end of my report. County Administrator's report.
Okay, so as you can see in the pack, we provided the department goals. We have the goals for the Office of the Aging. We have for social services. We have for veterans, and also whole health and the youth services. So as was discussed yesterday at length, at part of the goals for this year, the department were asked to provide department equity indicators. And if I'll give one example, like Office for Aging, their equity indicator is availability and health impact of nutrition and affordable food options for older adults. So these are some of the things that we're trying to measure and see the impact on the community. And if you have any questions related to any of the goals, I'm sure we have team from the department that can also respond. So these are the goals that we'll be working with for this year.
Thank you. Any questions? Is that it for your report?
Yes, that's my report.
All right. I did forget something. For the rec partnership, we have one more seat that we have to fill. They meet every other month?
Every month, but they skip months occasionally, in the
Okay.
summer and those kinds of things.
So is anybody interested in filling that seat?
I think I'm on there.
You are. I think we have to have two.
Two.
We have to have two.
What time do they meet? When do they meet? Do you know?
It's on a Monday, and there's one coming up.
Or Kate is here. She knows when they meet.
It's the fourth Monday, maybe?
Fourth Tuesday, Randy, from 5:30 to 6:30 on Zoom.
All right.
It's the fourth Tuesday?
The fourth Tuesday, yeah. Our Youth Services Board is on Monday, Randy. I think that's what you're thinking about. So the rec partnership meets February, March, April. They don't have a meeting in May, and then they meet again in June. And basically, at that point, they are just voting on the budget, the recommendation that comes through for the increase or whatever the percentage, whatever that looks like, based on what they determine. It comes through my department as part of the budget presentation. So they don't meet every month. It's just a few months out of the year that they meet. It's normally an hour. It's online. And it's just reviewing data from the prior year to make sure that we are on track and things are being done, and then provide guidance for the youth bureaus. They create the cost associated with running the catalog of programs that are included in the rec partnership for that year.
Thank you, Kate. Are you interested, Amanda?
I can't take another evening meeting.
All right, 5:36. I can do it. I'll do it. I'll do it. All right. So, Whole Health Department. We have a resolution authorization to execute a contract for primary prevention services, Whole Health Department, Rural Health Institute of New York, ID 13109. Is there somebody here from Whole Health? Oh, sorry. Do I have a mover?
I'll move.
Okay. And Randy seconds. And is somebody here from the Health Department? Whole Health? Hey,
Yeah,
take it away.
great. Thanks, everybody. So yeah, this resolution might look somewhat familiar. We previously had a resolution go through the authorized CARS and Cayuga Health System. Rural Health Institute was proposed as a subcontractor for this service. And OASIS did initially approve that, but then sort of moved back on that because they felt that the money allocated to CARS and Cayuga Health to provide this service for administrative oversight would be better served as in direct primary prevention services. So they asked that instead of contracting with CARS and Cayuga Health. We contract directly with Rural Health Institute. They've approved RHI and are, working with them to get set up as a prevention provider right now. And so this is just authorizing us to switch the contract from CARS and CHS to RHI directly.
Is there any questions? Are we ready to vote? All those that are in favor? Okay. So that passes. Would you want to do your report while you're here?
I'm happy to report on one aspect of our work, which is that we have recently signed a contract with Reach Medical for the Community Outreach Worker Program. That's a program that's been on hiatus for a while. We're excited to contract with them. They're in kind of the ramp up period right now, hiring and training staff. And we'll be rolling out some more public communications as this program gets started up, but just wanted to let you all know that it's been contracted and we'll be kind of reporting on it at this meeting, moving forward. And I think that's about it from me, but perhaps Jeremy has other reports.
Yep, I can do just a brief update. Obviously, Frank's last day was last week, so we are into the interim period here. You can see from our goals that we are still moving pretty quickly. So even during this interim time, we are going to continue all of those. We are putting a lot of effort right now, and our two boards are as well, into getting the job description right for the commissioner. So we are hoping, I know that we're hoping to get it posted very soon in the next few weeks here. But there was a lot of input and looking at how the integration has gone, making sure that now the job description sort of matches what the work really is compared to what it was, 5-6 years ago. So hopefully we'll have that posted and recruitment started soon. But we have a little bit more time for our boards to give input this week, and then we'll have everything over to HR. Does anybody have any questions for me?
Randy? I'm sorry, Amanda.
Thanks. I am going to ask each of the people who give a report, based on your department goals, just if you could say a few more words about your department equity indicators, the two things written here. I know it's a new thing and everyone's kind of adjusting, but if you had any other thoughts or things you wanted to share about how you're going to integrate that into your work. And I know you're also just getting up to speed with being the interim, so any thoughts you want to share?
Sure. We tried to give a little bit of background on ours because we incorporated it into our strategic plan, and that started in 2023. So we're actually quite a ways in. We use what's called cross-functional teams to work on any of our strategic planning items. And the longest running team that's going is our DEIB team, because we're trying to make it sort of bedrock, incorporate it into all the rest of the strategic plan goals that we have. So those are the current areas that team is working on, but they've already sort of moved through several iterations. We've provided significant training, both keynote speakers, outside speakers, inside speakers, over what we do is we have a Tuesday training every single week, and quite a few of them have been used for this purpose. So it feels like we're a long ways into this. And so what you're seeing there is really our short-term goals. The cycle right now is ending for the cross-functional teams to then start our next cycle. And so those are what we think are going to come out of this last team's efforts. And then we'll go right into implementation. One thing that you might note that's new there is these cross-functional teams go for about 6 months at a time. They gather tons of information, and then by the end of it, they make recommendations. And what we're finding is, in order to make this a little more practical, is right after they make the recommendations, we're going to put in place smaller technical teams to build out whatever they've suggested. And because a lot of this, we have to incorporate into our systems, and Whole Health has like 20 different databases that have fields that are out of date. So there's a lot of actual technical work that has to come along with this if we're then to give our staff the right forms to fill out, using the right terms, all of that kind of stuff. So it's a big lift. But I will say it's foundational to our entire strategic plan. So you'll see it, even if you were to look at any of these individual goals, it's embedded within them. So I think that's all I would say. At any given point, you guys can request where we are along that strategic plan, and we could update you there. But we're trying to be iterative so that the most recent information informs what we're doing right now, rather than just having a 5-year plan and trying to know what's going to happen in a year. So we're really trying to incorporate it all the time. They meet very often, and that team is winding down to then pass it off to the next team that will have the task of implementing some of those goals around DEIB.
Great, thank
Does
you
that
so
answer
much.
that?
Yeah, totally. That's great. It's wonderful to know that you're actually already been working on this. So this is nothing new for you. So thank you.
Yeah, I really appreciate the intentionality in that plan and effort and in that answer, so thank you. Randy?
Yeah, Jeremy, thanks for stepping up and leading. Following up from Frank's going to be difficult, and thank you for doing it. But I saw that there was a survey sent out, a community health survey. Did that go through whole health? And if it did, could you talk about it a little bit?
Yes, that is something that we have to do regularly, right? We have to do a community health assessment, and then we have to respond to that with a community health plan, right? So that survey that was just released is the most updated version of that. And we have a whole team that works on that. Sam Hilson is the primary driver. So in the last week, I will say that I have not come fully up to speed on that. So I could give you as much detail as you want, but I would have to follow up with Sam on whatever your questions are. But that is our normal sort of cycle of things, is to put that out to the community and then take that data back to inform our plan.
Thank you. And my second question, I can only speak about the Newfield Central School because that's the only people I meet with. And they've been struggling, as I think most schools have, with mental health, student mental health. And I don't know if you follow what's going on in Newfield, but they decided to ban cell phones in their school a couple years ago. And now they're seeing, and now it's completely done. They phased it in, now even the high school. And they found that kids are much more engaged, they're dealing with a lot less issues, and that the kids are adapting. But they're still struggling with kids that are struggling with technology and consumption of it, and they're seeing a lot more violence, frankly, from a smaller group of people, but they're much more intense. And when I spoke to Frank about it, there was a concern about the number of mental health people that from the county that can actually work in those schools. And of course, there's a budgetary issue there. And I realize this isn't the right time for it now, and you could look into this for me, but I'd like to understand better how many of the school psychologists or psychiatrists are in the schools, and if there's a communication directly with the schools of the needs that they claim they have.
Yeah, it is a complicated question. It is. As far as social workers, it's where we've hired the most recently. I think you guys have seen updates on that as far as how many schools we've added, and we're adding 2 more currently, just waiting for OMH approval to do so. As far as that communication piece, that's what our social workers spend a lot of time doing that. That's part of the reason why there's a budget concern is it's hard to pay for those services with how much coordination is needed. But I will say, as far as individual schools all having the same issues, I haven't necessarily heard that, right? Are they all talking about cell phone usage in the same ways? Or are they getting together and having any of that kind of conversation? I haven't heard that part of it. So I'd have to get you some more information about that. But our teams that go to those schools do interact with the staff as best they can. that staff is extremely busy. So we're, a supplemental service that is there, and it's not always easy to integrate us in.
Okay, well,
And-
I put it on your radar. That's enough for today.
Okay,
No, it's
all
a
right.
big subject, I understand.
Any other questions for Jeremy or for Whole Health? Thank you for your time, Jeremy. We
Thank you.
have a resolution from the Health Department. I believe Kit is here. Authorization to execute contract for primary prevention services. Oh, sorry. Budget adjustment, Department of Social Services and Youth Services. Safe Harbor, ID 13030. Do I have a mover? Do I have a seconder? It's Amanda. I got to pivot both ways. Kit, would you like to talk about the resolution?
Sorry, Travis, sorry for the delay. I think that if this is a safe harbor resolution, this is passing through to Kate, and I think that Kate might be able to give us more detail.
Thank you. Kate?
Yeah, no, happy to. And that's exactly what this is. This is state aid for the Safe Harbor, our CSEC critical team that comes through DSS and is subcontracted with us in the amount of $30,000. I do want to just note that this is $10,000 less than we received last year. But this is just going through, this is the process to accept that. We have a contract mostly with the Advocacy Center. We do education and awareness campaigns, bring in some trainers, talk critically about making sure that the services that we need are available, and how to address those to the best we can within the amount of money that we're allocated in our partnerships that we have throughout the community. So, and this comes later than the acknowledgement of what this amount is comes later after the budget's complete. So we never know what it is. So that's why it's not included in the budget. This is why that's why we're doing this.
Thank you, Kate. Any questions for Kate? Kate, how does, if an agency wants to partner with you all, if they want to get involved, how do they do this? Who do they contact?
So they basically just can email me. I've got a list of folks on like the critical team. I think that you have actually also been included in some of those emails, for example. So if you would just let me, like for GAC, just let me know who you want to be on that, and I'm happy to include them. So just let me know.
All right, thank you.
Yeah.
Kate, while you're here, would you like to give any updates for your department? Oh, wait, Kate, I'm sorry. I'm skipping ahead. I'm moving too fast.
It's okay.
All those in favor of Resolution 13030, that's 4. All right. Okay, you can go ahead, Kate. Sorry.
Okay, yeah. So hold on one second. So our equity indicator got cut off in your packet. At least it's looking like that online. So I just wanted to, what we are going to be doing for our equity indicator is equity stakeholder engagement with youth development programs that are supported by achieving youth results. And what you don't see under that, at least I don't know that you see it, is there are 3 bullet points. Basically, what we are doing this year is taking the data that we collect from our agencies. We've worked with our rural youth services to actually collect some of the same data, and we're going to be delineating that into looking and to better defining what marginalized groups are, and that could be things based on race, ethnicity, gender. It could also be based on location, so rural and urban. We're going to be looking at that, pulling those numbers apart, really. We're working in our department to make sure that that information is displayed in a more user-friendly way on our websites. Hopefully, the goal is to be able to do cross-tabulations on some of the things that we're collecting. And ultimately, what this will do will drive our decision-making for our next RFP process that's coming up in a couple of years. And so some of the things that we're doing around just goals for our department for the upcoming year are going to be looking at doing a community needs assessment. The last one that we actually did was in 2010. A large book was produced, and that basically told us that childcare is an issue, housing is an issue, transportation is an issue, right? And so what I really would like to do this year with this is not necessarily, we'll update those numbers, but not necessarily focus on things that we already know are going to be issues. They were issues 10 years ago, and hopefully they won't be in 10 years from now, but currently we know that they are, but really focus in more in some of those post-COVID impacts on families. So it might be screen time, it might be anxiety, mental health, just sort of what the needs are in the communities. So we'll be doing community conversations, going around getting input from different community stakeholders and putting that together. And then hopefully creating a system that we can post on our website and just update so that we don't have to wait every 10 years for the census data to come out to sort of trigger us to do this sort of publishing of data that's important. So.
Any questions for Kate? Randy?
Yes, hi, Kate.
Hi.
I like goals 2 and 3 that you have here. And I think the key to have success with these is communication. And how is the hard part, right? How you reach people and communicate it. And I'd be glad to work with you on that.
Sure, awesome. We do really plan on using our municipal youth service youth commissions in the different communities as well. So we'll definitely be in touch. Thank you.
Any other questions for Kate? Okay, we do have another resolution. Budget Adjustment Youth Service Department, final 2025 state aid figures, ID 13104. Do I have a mover? Seconder, there we go. Go ahead, Kate.
Basically the same story as the last time. These are final state aid numbers that came to us from OCFS after the budget was completed. And so this is just an adjustment to accept those funds and put those into the proper allocations with our community partners.
Thank you. Any questions for Kate? All right, let's take a vote. Those in favor? And that passes.
Thank you.
Kate. And now we'll move to departmental updates. Let's start with Lisa from COFA.
Hi there, how are you?
Hi, Lisa.
The only thing that I wanted to mention is at our annual luncheon each year, which is in May, in recognition of Older Americans Month, now is the time that we're seeking nominations for outstanding volunteers for people that are over 60 in the community. So if you know someone that has been, has contributed a lot to the community and would like to nominate them, we have a subcommittee from our advisory board that works on going through the nominations and chooses people. They'll be recognized at our annual luncheon, but they'll also be recognized as part of Older New Yorkers Day in Albany on May 27th this year too. So that's coming up. So that's really just my only announcement.
Okay, any questions for Lisa? Amanda?
I'm going to ask you about your department equity indicator that you've listed here, and if there's anything else you want to say about it.
Yeah, so, and I didn't actually list it there, which is, I didn't realize I was supposed to do that. But, all in all, I'll just say that this is something that we're very used to doing with our programs and services. Most of our funding, we're required to target populations, age, low income, minority, rural, we are asked by the state to do that. We track it. We track it in almost every single program. So it's part of our 4-year plan, just naturally that it's part of our programs and services to do outreach. We've kind of chosen one specific area. And I, of course, I had mentioned the nutrition part is our indicator this year in food deserts in areas, and we're going to be using some of the GIS data that planning has done to kind of target our outreach efforts in that area. But also a big part of this, again, required by the state to kind of implement these things in our plan as well, is to create that and disseminate the needs assessment. Food is such a huge part of our budget, our nutrition program is. And we've seen our numbers decline. Our home delivered meal numbers have gone down. Our congregate sites have decreased. So we want to know why, and in doing that kind of needs assessment, we also want to determine, are we meeting the needs and preferences of, cultural needs and preferences of people, special diet needs of people in the community? Is this why our numbers are going down or what can we do differently to make sure that we're serving the people that actually need it? So I guess bullet point 2 is where that fits into that specific equity indicator. We also tried to kind of make this part of our normal flow. So it also flows with our KPI and our strategic plan. So we've kind of like matched everything up. So it's just embedded in what we do in that certain area. The first part of obviously will be data collecting, and then future years down the road with this indicator, we'll figure out what to do with it at that point. But first, there'll be the needs assessment to just collect and see what we can see. So hopefully that answered your question.
Amanda?
Great, yeah, thank you so much, that's great.
Yes.
And, you know, that's what's good about having this annual equity report, is that we're talking more about it, and we're actually finding out that departments are doing this work. So now we're just kind of talking about it more openly. I have a lot of questions today. So I'm gonna ask you, so I actually ran into Bob Slocum last week, and just sitting here thinking about that and talking to you, I was just wondering about the PERS program. And is that still operating? And I don't know if people here even know about that. So, yeah, the PERS, but you can explain, Lisa.
It's the Personal Emergency Response System program that, most people know it by I've fallen and I can't get up buttons. But yes, we still do that program in our office. We have about 400 people in the community that are using our PERS system. The GPS watches are becoming more and more popular. Previously, it was kind of a little station box that was in your home, and you had a necklace or maybe a wristband that you could go only so far in your home before it wouldn't connect with the main base of it. But now the GPS are becoming more popular, and we're able to track in a different way. We still have a contract to do the medical equipment piece of it, but my staff are the ones that actually go into the homes, install the machines and take them out if needed. And that way we can, it's our one step in the door to see if there's other services and needs that people have right in their homes. So yeah,
Thanks.
Still big program.
Great, thank you.
Randy?
Yeah, thank Lisa. So the 2 additional congregate meal sites, where are they planned?
So one is hopefully starting in March. We haven't, it's almost in place, and I haven't got my final approval from the state, but I'm saying that it's going to happen. So that's going to be in the Slaterville Firehouse. So we're trying to get out into the rural areas, and it's going to be part of a respite drop-off location too. That's a program that we have through AmeriCorps to help caregivers. So somebody can drop off their loved one and go run some errands. There'll be volunteers that are running that piece of it, but they'll also be able to get a meal while they're there. So that's going to start off at one day a week. Hopefully, if it's successful, we can try it out in other rural areas and maybe do Enfield one day a week or Newfield one day a week. We're still working that out. The other one is not completely I can talk about it, but it's not completely settled at this point. But hopefully it's going to be in the mall space, which will be, there was a little cafe that used to be there, where FoodNet right now is in talks with Cuba Health because they own that space. So we're working that out, and hopefully that will be another site that people will be able to access. It's on a bus route. We're, in communication with Gadabout to see if we can have people get dropped off there at certain times. So, we hope that's going to be a good site, because it's not only is where a lot of the doctor's offices are now, but people like to do mall walking so they can get a meal and they can walk the mall and do things like that. So it fits into the concept of our nutrition program.
Oh, that's great. There's plenty of parking.
Yeah.
It's accessible. That's awesome.
Yeah, it is.
Any other questions for Lisa?
That is great. I have one last thing just to point out. So on your bullet point number 6, your Caregiver Resource Center, perhaps
Yes.
You could give a report on that more in depth at a future meeting. That'd be helpful.
Sure. I'd be happy to bring our caregiver coordinator who runs that program. She's a social worker, aging service specialist that we have here. And yeah, we can definitely do that.
Great, thank you.
Awesome. Thank you, Lisa. We are
Thank you.
going to move on to Veterans Affairs with J.R. Claiborne.
Mayor. There we go. Everybody hear me?
Yes, sir.
All right, good afternoon, everyone.
Good afternoon.
Hey, congrats on the first meeting. It is going crisply.
Thank you, sir. Thank you.
All right, just in regards to updates for Veteran Services, this month we hosted our the VA's Patients Council, which is a twice monthly meeting that we hold. Also, our Warrior Writers, which is held twice a month. I said that wrong. The first one we hold every 2 months. We host Warrior Writers is done twice monthly. In addition to our direct service with our clients, we also have some things underway for March. The big thing is we're preparing for our Vietnam War Era Veterans Recognition Day, which will be at the end of the month. More information to come. Also, we're working with Cornell Law School to get a veterans drop-in clinic for veterans to be able to come in and ask questions of legal areas. I think right now their limitation is criminal law is not part of that. We'll also be working with ClearPath for Veterans. They're having a open house in next month, and one of the things that they're going to be doing is a VA login class. And so that, excuse me, I want people to go there because there are being questions now. The VA has changed how veterans can access their information, particularly their health information. And it's really caused quite a bit of confusion with some folks. So working with ClearPath for this first one and gauging if we can do another more classes for our veterans here locally. And then lastly, I just want to give a special shout out. There's a lady locally named Sis Johnson. I don't know if some of you may know her, but she is a knitter with Pew Knitters of the Varna United Methodist Church. And she has these things that she's created called stump covers. And they're just what they sounds like. They are knitted covers for people with amputations. So one thing she's talked about is that particularly in this time of year when the temperatures are really cold, people with amputations have a lot of sensitivity in those areas. So she has 2 sizes that she's knitted, and she's done them by hand. I guess there's not another way to do knitting, but she does the knitting. The 2 sizes, large and small, to cover the different extremities that may be in need. And she always makes sure each year that we try to get word out about that veterans will know that we have those available for them. So they are available here. They're also available through her and through Sis Johnson, and she also has some up at the VA clinic. And this has been a labor of love for her, and I just appreciate that she continues to do it. And her thing is she says she wants every stump covered.
That's great.
Any questions for Chair? Amanda?
My question, do you want to talk a little bit about your department equity indicators and what those mean for you?
Sure. The first one, the access to public services. The reason for this is that we do refer people to quite a few local agencies. The main thing behind it is that there's very few things with the VA that you can get immediately. Most things are going to take weeks to months. In the meantime, there are services available a lot of times that we can refer people to in the meantime. And so to be able to get a better picture of that, like if you ask either Michelle or I, we can tell you off the top of our head who that is, but how many we do that, that would take some more work. So this is actually going to be a chance to focus on actually counting that up. And through that, also learning if there are holes that we're missing. Maybe there's another place, other agencies to search out for partnership. And in doing that, that will help us serve our population a lot better. The other one is the intentional inclusion is really a big one. What I've learned in my work here is that there are veterans through different times, through the different conflicts, including Cold War. And some of them come forward. Some of them, their spouses are who are bringing them forward. Some of them have no idea that this office exists or even that they themselves as a veteran may be entitled to some services. And then there are other people who are who may not be veterans despite the fact that they served, say, in the reserves. And so to be able to look at targeted outreach, look at events, look at things that help recognize those folks and the subsets within that, veterans of color, women veterans, even veterans there are a lot of veterans with disabilities, but there are some that are, we call the invisible wounds of war. And there are also some who have the physical wounds that may need other resources. So to be able to do things that bring them out, to reach out to them, I think will definitely be something that serves both this department well and reflects well on the county.
Great, thank you so much. That is important work.
Thank you.
Any other questions for JR? JR, one of the things that I'm hoping to do throughout the course of this year is have each department that comes to HHS have a meeting where they are able to give a presentation about their department, accomplishments they've had over the last year or two, projects that they're working on, upcoming things, needs that they have in their department. I was wondering if you'd like to start us off in April.
Yeah, I'd love to start it. I just have to look back at my calendar to make sure April's good. There's a few things happening there that, yeah, just let me get back to you on that to confirm that. But I thank you for that invitation.
Absolutely. I look forward to hearing from you, and thank you for your updates.
Thank you.
We will move to Human Service Coalition with Cindy Wilcox.
Hello, good afternoon.
Good afternoon.
Hi, sorry. You caught me with lunch. So we have been pretty busy here at the Human Services Coalition, primarily in areas not-for-profit agencies updated on the going on at the federal level and the executive orders and the potential Tompkins County.
Cindy, you're breaking up a little bit, and your camera's frozen.
I know that yeah.
Cindy, can you hear us?
Oh, am I?
Well, you're breaking up.
Oh, okay, hold on. What if, maybe if I turn my video off?
That might help.
I can. Hey. Can you hear me now?
Yes, we can.
All right, let's take two. So we're busy trying to keep on top of all of the executive order things happening at the federal level and trying to keep agencies updated and helping them think through some scenario planning, those kind of things if and when budget cuts start to impact agencies in Tompkins County. I know the continuum of care reports to housing and economic development, but just to give you an idea, you know, the new HUD secretary is looking to substantially cut HUD funds. And we here in Tompkins County receive $1.6 million in COC funding alone. And that's only one federal source of funding. So we are trying very hard to kind of stay on top and plan as much as we can. You know, also Medicaid cuts. We have there's affordable accountable care, Affordable Care Act cuts on the table, of course. So, you know, that could help affect our health insurance navigation programs, and then a whole bunch of other programs across the county. So we are busy doing that. We are also ramping up for the city county funding review process, which we do every year for the county. Applications are expected to be released probably sometime in early March. We're using a similar process from last year, which is kind of putting some information on the HSE website, sharing that link with the legislators and others so folks can easily access it. So we're in the midst of that. We had a great meeting with County Administrator Corsa Comfy, and we kind of brought him up to speed on the process. So we're looking forward to a smooth and effective process this year. And we turned 50 last week.
Nice.
HSC did.
Congratulations.
Not City Wilcox. I've surpassed 50. Yeah, it was a great party. We had about 65 people in attendance at Cultivare, and it was a fun celebratory event. And we're looking forward to the next 50.
Awesome. Congratulations.
Thank you.
Cindy, the applications, you said they'll be on the website?
Yes, we will. Yep, we'll have a link. Yes, we'll have a website with a link to the application so folks can easily download.
So any agency?
And we'll send them to you. Also,
cool.
all the legislators will get that link as well.
Thank you. So any agency, funded, never funded before, new to the process, whoever they are, at some point in time, people will know the date. They can hop on the website, go to the link, and then go through the process?
That is correct. We have to coordinate that with county administration, but yes, that is correct.
Awesome. Thank you. I know
You're welcome.
that you all have been working on that, so I really appreciate hearing that. And I think you started that last year, correct?
We did, yes.
So
and
cool.
I think last year we got, don't quote me, I think it was 4 or 5 new agencies in the process.
That's great. Thank you.
Yep. You're welcome.
Questions for Cindy? Cindy, there's no questions.
Okay, great. Thank you.
You are welcome. And we have Department of DSS, Kit Kephart.
Hi, Travis.
Hi, Kit.
We are busy over here working on a number of different things, but obviously continued expansion of shelter. Currently, as of the 2nd of February, we have about 112 individuals sheltered through our THA program. Actually, it's 91 through THA, about 78 adults and 13 children, and then 21 that are in our Code Blue program, 16 adults and 5 children that are not at the Code Blue shelter. We've been running, the Code Blue shelter varies a lot, but in the colder nights, like we've been experiencing lately, we're more in the 35 to 40 person range. And then when it gets warmer weather, we drop down into 25, 27 person range. So that's kind of how that has been operating.
Excuse me.
Oh, sure.
Just to clarify, so for Code Blue, for the Key Bank shelter, it's 25 to 35 depending on the weather?
It's in the colder, like this week and some of the time last week when it was cold, we're running more in the 35 to 40 person range. And again, you know, part of what makes it tricky to have numbers, Travis, is that we see that vary a lot, sometimes hour by hour. But I would say that in general, that's what we're seeing. When it warms up, like we had a warm snap a little while ago, a couple weeks ago, and things got warm and more temperate, then we were seeing more in that 25 to 27 person range a night.
Got it. Thank you.
Sure.
And the 21 number, that's Code Blue, but not at Key Bank.
Correct.
Okay.
Yeah, those are primarily families that are sheltered, but they're sheltered under the Code Blue program. We do have some single individuals. We really, we're trying to manage people when they come in and they are Code Blue, but they are not able to, to be at the Code Blue site because of either disabilities or they're elderly or things like that. Then they're at other sites. So, yeah.
Thank you. I think it's important just for people to understand that Code Blue isn't just in one place, and we have different sites. And so the numbers that you report are from Code Blue altogether, but spread out at different places. So people really understand the significance in the numbers that some nights you all are housing close to 70 people, but not just at one place. So people aren't thinking, oh, this isn't a big deal. It's only, 21, there's only 35, that they understand that on some nights we're looking at close to 70, and it's in different locations. So you have to go through different processes, and you got to work with different sites. So thank you.
That's correct. And actually, some nights it's actually been pushing up towards 80. So yes, you're completely correct, Travis. That's, yep. And it's hard to, it's a hard number to always get a grip on because of the nature of people coming and going at various, especially at that Key Bank site. But yes, that's where we're at. So, yep. So that's kind of a view on shelter right now. We are very focused on shelter. We are obviously also, working on a number of different other initiatives. We're watching very closely. I have a lot of concern right now about what's going on at the federal level and how it will impact us. We're just watching that closely. We haven't received a lot of guidance. I think the state is still trying to figure out what's coming, but I think that's what we're working on and trying to make sure that we are that we've got programs intact and working towards keeping those cases going. We've got a number of new hires on our eligibility team. We've had a number of significant retirements over the last number of months, and so we had been recruiting for a while, so we just have brought on a new group of people. So there's a lot of training happening in-house and people working on bringing folks up to speed. So that's kind of in a nutshell where we're at.
Thank you. Is there any questions for Kit? Amanda?
Yeah, so you, in your goal page here, it says your department equity indicators under development. Just wondering if you had any update on that or what you think that might be for your department.
Sure. So this is an area that we have really worked at very extensively over the last 5 years. We do an annual diversity and inclusion related training every year. We have had a number of contracted providers that we have been working with around this, and we are continuing that process, as well as there's a number of things related to our practice that we work on. Some of those mandated by the state, others of those elected. One of the things that we put in place a couple of years ago is our Kin First firewall and what's called blind removal. So these are practices that we incorporated into our child welfare process. I know I had talked about this a couple of years ago, but that's a whole process of really looking to eliminate the racial disparities in child welfare. Beginning to when we are responsible for assessing whether or not a child can be safe in the home, really evaluating that without a lot of the demographic information and being able to really evaluate that blind, as they so call it. So those are initiatives we've had going for a while, and we continue to move forward, as well as our Kin First firewall, which is to always try to place children with kin, or what we call fictive kin. It is a lot less traumatic for a child, obviously, if we have to, if parents need to go off to treatment or get supports. It's much better for the child if we can find a connected person that child can be with. So those are all processes that we continue to look at and improve and try to address. And then the ongoing training for staff, as well as solution-focused trauma-informed care, which is kind of part of this as well. And then we are in this year, but we haven't quite done all of it yet. We have a group internal that works on developing the plans for training around DEIA and looking at how we move those initiatives forward. That group renamed itself at the end of last year, beginning of this year, the Kaleidoscope Group. And so that group is continuing to work on that and work within the department to to kind of make voices heard around where the training's needed and what we can do to kind of support those initiatives. So those are all things that we're underway with and continuing to move forward.
Great. Great. Thank you. Thanks for the update.
Sure.
Kid, as somebody who has gone through the I forgot what it was called back then. This is about 8 or 9 years ago. But the program to become a foster parent for a relative, I thought the department and the folks that ran that did an amazing job, like absolutely amazing, getting us through to be qualified as a foster parent. And in those situations, it was so difficult for some of the family members who were going through that process, given the trauma that they were dealing with that put them there to begin with. And there's also a lot of conversation in the community about the lack of foster parents. I was wondering maybe in June if the folks that run that program, the whole foster program, wouldn't mind coming to share with the legislators at HHS to talk about the program and what's going on and the needs. I know that getting people to be willing foster parents in this community is tough, and we don't have enough, especially for teenagers. There's a tremendous need. So I think it would be great if they would be willing to come and we could help shine some light on it and share with the community and the legislators as well. Do you think they'd be willing to do that? You can get back to me. You don't have to answer today.
Sure. I will definitely explore that. Travis, I appreciate the compliment because that means a lot. And I know, our foster care team is they're our foster and home finding team. They do a great job. And I know they would appreciate the compliment. I certainly, I was a foster parent years ago, and I was amazed at the amount of work it takes to become a foster parent and for the staff to help you become a foster parent. And I agree, they did a great job. Mine was a long time ago now, but they did a great job. I will definitely ask them. I am a little bit out of touch with, I know what they do and how they do it, but I don't know exactly when the scheduled foster parent trainings are for this year. So the only thing that might get in their way is how intense their schedule is at that time of year. But let me ask them. We can definitely do it. At some point, I will ask them if June works, and if it doesn't, I'll get back to you either way, and we'll find a time for them to come and present. They do a great job.
Yeah, if June doesn't work, ask them what month does, and then I'll save that month for Is it still Aaron? Is Aaron still?
Aaron works with it. Coral Utweiler is the primary supervisor. So I will talk with Coral, and we'll put that together. Absolutely.
Awesome. Thank you.
Sure. Thank you.
Any additional questions for Kit? Well, thank you, Kit.
Thank you.
I think that's the last of the departments. If I missed anybody, please say something now. I don't want to skip anybody. JR, you got your hand up?
I do. Yes, I do. I just, something that Kit said just triggered this for me. The veterans is a protected status. So pretty much everything that I work with, all of the clients that we have are within the protected status category. So when we're talking about DEI and DIB and everything else, it's just something that I have to remind others because I'm always in my own head that everybody that I work with is a protected class. So I know that's been the big thing about who is who and what, but my whole clientele base is, it's just a matter of me working with trying to identify the different subgroups within there so that we can make sure that we're delivering services for as many people as possible.
Thank you for that. Let me ask you, how does the conversation with the current administration, how does that work with veterans, considering that they are in the protective class? I don't think people understand the different, I don't like to say this, but the different categories of folks that would be in that protective class. I don't know if people understand just who we're talking about.
Yes, so far we're still holding our breath. I mean, the news that there were 1,000 people cut from the VA has made a lot of concerns because most things that we do are with the VA. We don't work for the VA, but we do interface with the VA, Veterans Administration, and so there's big concern there because that hits across the board for us. My funding right now is pretty much state and local. So I don't know, I'm not going to say we're insulated because I'm not that naive, but right now just holding our breath to know that whatever else might hit us. As requirements get put out that try to curtail or limit observations and services, I'll be putting heads up. Excuse me, let me say it differently. If I am impacted, I will definitely be letting a lot of people know, especially all of you, because I work with a group of people who have put their lives on the line for our country. And for them to be run into more limitations than they already have is very concerning.
Thank you. Thank you for bringing that up.
Most definitely, thank you.
Any questions for what JR just, all right. So is there any committee member reports? You don't have any, Randy? You sure?
Is that?
Just messing with you.
Yeah, no, I don't.
I could just say.
Go ahead, Amanda.
Sure, just to say, I kind of said to Travis at the beginning about the Health Planning Council, they meet at on the same Monday as Peak is now meeting, so it kind of overlaps. They meet at noon. It's almost every month. It's a great group. They do a lot. It's through the health department. They do a lot with community health work and the community health improvement plan that we talk about. So if anybody on HHS or any other legislators want to be on that, it's going to be a little difficult for me to do with the overlap meeting. But I've been on and off for most of my time on the legislature, and I really appreciate they bring together, people from all over the community and all different kind of health partners to talk about some of these issues that affect everybody.
What Monday is it, Amanda?
It's the same Monday as Peak. I think that's the second Monday. Cindy has her hand up. She might know because she goes to those.
Hi, yes, I just a little correction. The Health Planning Council is actually a Human Services Coalition committee.
Oh, sorry.
Yes, that's okay. But it is definitely multidisciplinary and very much in partnership with Whole Health. And the Health Planning Council meets every other Monday on the second. Hold on one second. Yep.
I think it's
second Monday of every month at 12 noon.
And she's not a director. What is Nicole's?
Yep, she's the director of health planning, and she also is staff to the committee.
Yeah,
so
and she wants. She's reached out to me, and she wants to kind of talk, and she actually wants to come here and have a little bit more of a connection with this committee this year. I feel like that has kind of been lacking in recent years, like folks maybe don't even know what they do. So I'm going to talk to her a little bit more, and we can talk about when they could possibly come. And
I would definitely be open to that, sure.
Okay, great.
Yeah, just one more thing. It also makes a lot of sense for this committee because, the kind of the integration of health and social needs is very prevalent right now, and the Health Planning Council and HSC's other work around human services planning, it's all kind of coalescing, and I think this is the perfect place to bring those together.
I have a standing meeting on Mondays. If I could make some changes to that, then I would be.
Okay, we can talk.
All right.
Okay.
Randy.
Yeah, I want to do in our budget process. Cornell Crop Extension was managing a student resource navigator for healthcare between numerous organizations and whatnot, and we didn't fund that. It was through Cornell. They had students involved and whatnot, but they got funding from someplace else. And it's a collaboration between Hugo Medical and 10 other health providers. And they get funding for 1 year, and their goal is to summarize everything they're doing and provide data back to the value of this program, and hopefully get funding from somebody else. And they are collecting data, and basically what they're doing is to help people navigate the healthcare system. So that's their goal. Another thing that came up from the Food Policy Council, and I think food kind of fits here with food banks and whatnot. There's been changes there, and there's an organization called the Tompkins Food Future, which actually developed the Food Policy Council through Cornell Crop Extension. Well, the Tompkins Food Future is going to leave Cornell Crop Extension. As it happens, organizations leave from time to time. They've met, they had a big forum, which I attended at the library in the Borg Warner room. And after all this meeting discussion, they've decided they're going to turn over the Tompkins Food Future to the Southern Tier Food Bank system. And it's because there's a bigger collaboration of all the food banks are coming together, and they have the ability to raise more funds and take donations, and they have a system set forth. So that's happening right now, and it'd probably be a good idea maybe in a couple months to have the people from the Southern Tier Food Bank come in and explain what's going on with that.
Absolutely. I love that organization. All right. Any other sharing from? All right. Oh.
Yeah, I just want to remind folks that next month on the 19th, OTDA will be visiting the committee. So if you have questions, if you have some clarification on your work and what you do with us and the relationship, please get them together, and they'll be here to answer our questions and also explain their programs and things that they do for us.
Thank you. Well, that means we are adjourned. Thank you.
Thank you. Great meeting.